Suspension. Suspension is a biphasic liquid dosage form containing insoluble solid material suspended in a liquid medium. Particles range from 0.5 to 5 micrometers. There is a continuous phase dispersion medium, and there is a disperse phase and insoluble drugs. Advantage of suspension. Pharmaceutical suspension are useful for drugs having low solubility. Suspension can improve chemical stability of certain drugs like antibiotics. Suspension can be formulated to provide controlled drug release. Drugs in suspension exhibits higher rate of bioavailability than other dosage form. Bioavailability is in following orders: solution, suspension, capsule, compressed tablet, and coated tablet. Suspension can mask the unpleasant and bitter taste of drug. Suspension may be beneficial for patients having difficult to swallow solid dosage form. Disadvantage of suspension: physical stability, sedimentation, and compaction can cause problems. It is bulky sufficient care must be taken during handling and transport. It is difficult to formulate. Uniform and accurate dosage form cannot be achieved unless suspension are packed in unit dosage form. Features: slow settling and readily dispersed when shaken, acceptable odor and color, gets easily into syringe or flow easily through a needle. It should be physical, chemical, and microbiological stable during its shelf life. Parenteral ophthalmic suspension should be stretchable, spreads over surface but does not run off, providing a film containing the drug. Suspension classification. Based on the route of administration, suspension are divided in four categories. First one, oral, ocular, parenteral, and topical. Oral suspension are consumed by oral route. Oral suspension contain flavors, sweeteners, easy to swallow of insoluble drugs, shake well before use. Accuracy of dosage form is less. Now, ocular and ophthalmic should be sterilized, isotonic, viscous, packed in suitable container, easily installed into eye. Parenteral suspension. Particles pass through the needle of syringe, not produce any crystal growth. Solid particles concentration must be in between 0.5 to 30%. And external suspension. This suspension apply on the skin for protection purpose, antiseptic. Example is the lotion or drops. Based on proportion of solid particles, suspension can be classified into two categories. One is dilute suspension and another one is concentrated suspension. Dilute suspension, the percentage is 2 to 10%, and the concentrated suspension percentage is 50%. Based on size of solid particles, suspension are three types: colloidal suspension, coarse suspension, and nano suspension. Colloidal suspension, the solid particle size is 1 to 2 microns, and coarse suspension more than 2 microns, and nano suspension less than 1 nano micron. Preparation of suspension. Suspension can be prepared in 5 steps. The first step, suspension are prepared by grinding the insoluble materials in the mortar to a smooth paste with a vehicle containing the whitening agent. The next step, all soluble ingredients are dissolved in same portion of the vehicle and added the smooth paste to set on to get slurry. In the next step, the slurry is transferred to a graduated cylinder. The motor is rinsed with successive portion of the vehicle. And the step 4, decide whether the solids are suspended in a structure vehicle, flocculated, flocculated and then suspended, and the vehicle containing the suspending agent or flocculated agent. And the last step or step 5, make up the dispersion of the final volume. The suspension is prepared. Based on sedimentation behavior, suspension are two types: flocculated suspension and deflocculated suspension. Flocculated suspension flocs, the loose aggregates, are first formed, increase the sedimentation rate due to increase in size of sedimenting particles. Hence, flocculated suspension sediment more rapidly. Sedimentation depends not only on the size of the flocks but also on the porosity of the flocks. And the deflocculated suspension, individual particles are settling, so rate of sedimentation is slow, which prevents entrapping of liquid medium, which makes it difficult to redisperse by agitation. This phenomena also called cracking or claying. Difference between deflagrated suspension and flocculated suspension. Particles exist in suspension as separate entities. Particles from loose aggregates. Rate of sedimentation is slow since each particle settles separately and particle size is minimal. Rate and flocculated is rate of sedimentation is high since particles settles as a flock which is collection of particles. Third, a sediment is formed slowly in deflocculated and in flocculated. A sediment is formed rapidly. Fourth, the sediment eventually becomes very closely packed and flocculated is very loosely packed. Fifth, the suspension has unsightly preparation due to the formation of sediment, and the flocculated is elegant preparations are obtained due to uniform distributions of loosely bonded flocks. Period of standing flocculated and deflocculated suspension. There is a short period, medium period, and long period, whether weeks or years. List of suspending agent: alginates, methylcellulose, hydroxy methylcellulose, carboxy methylcellulose, hydroxypropyl methylcellulose, hydroxypropyl methylcellulose, microcrystalline cellulose, and hydroxycrystalline cellulose, bentonite, carbomer, powder cellulose. Formulation of suspension: finally divided particles. Particles are added to dispersion medium. Whitening agent is added. After that, deflocculated suspension is prepared. And this deflocculated suspension, the addition of structured vehicles and give the deflocculated suspension is external vehicle, and another is the flocculated agents are added, then prepared flocculated suspension, and the flocculated agents are added. After that, additions or of external liquid vehicles, then flocculated suspension and external liquid vehicles are prepared. Types of pharmaceutical suspension: antacid oral suspension, antibacterial oral suspension, dry powders for oral suspension, as like antibiotic, analgesic oral suspension, anthel, Mentic oral suspension, anticonvulsant oral suspension, and antifungal oral suspension.